I'd like to introduce myself. My name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in Boston for the last 5 years. I opened my own practice a few months ago, and I've been working with the Community Online Academy since it started. And I'm excited to bring you guys this program today. This is managing back pain with a foam roller. So we have a 30-minute program. We've got a lot packed into this time, so I want to get moving. But before we do, just make sure that you guys listen to your body throughout this program. Many of you guys have taken my classes with me before, but if you're new to this program, please listen to your body. I offer options and modifications to make the exercises appropriate for almost everyone. If something doesn't feel right, please modify or take a different option. That being said, you'll get the most out of this workout by really listening to your body. So we'll get started. We're going to take our rollers back onto the mat. And I will start by lying my roller perpendicular on the mat and bending my knees to place my feet on the other side of the roller. And then we're going to go ahead and lay all the way back down, letting your head rest down. And we're going to actually start with the roller underneath our sacrum, so under our hips. And our sacrum is the bone that's between our tailbone and our low back. So we're going to lift the hips up, bring the roller underneath your sacrum, and go ahead and rest your hips down. And it should feel fairly comfortable to do that. If it doesn't, go ahead and move it around until it does feel like a comfortable start position. We're just going to rest here for a moment. I like to start class in this way as a way to decompress our spine. So by lifting our hips a little bit higher than our shoulders, our spine gets the opposite effect of gravity and actually creates some space between the vertebrae. So if you ever have feelings of tightness or compression in your back, this is a nice little trick that is really not an exercise. It's just lying here that can give you some relief of your back symptoms right away. Now, as we lie here, we'll tune our attention into our breathing. So try and breathe up into the front of your ribs, breathe wide outside in your rib cage, and actually feel even breathing into the back side of your ribs. So like you're breathing your back body down into the floor. And that expansive breath should help you to start to activate some of our deeper core muscles, as well as relax some of our back muscles. We're going to go right into a little bit of stretching here today. And this is a cool stretch because we're going to get two muscles in one stretch. So what it looks like is bringing our right leg up to the ceiling. You're going to straighten it out. And if you really can't hold the leg straight, that's fine. You're going to keep a soft bend in the knee and then grab behind your thigh, walking your hands up as high as you can. So maybe it's just your thigh, maybe it's your knee, maybe you can get to your calf. And then you're going to straighten the opposite leg. And you're trying to reach the opposite heel down towards the floor. So in this case, I'm holding behind my right leg and pulling my right knee in towards my chest, but I'm also trying to reach my left heel down towards the floor. And if you don't feel the stretch on the front of your left hip, you want to bring your left foot a little bit closer to the midline of your body. And if this feels like strain all the way into your foot on the right side, bend your knee just a little bit. So if you guys can imagine, this is kind of like doing a split, right? But we're doing it up in the air, and that creates that nice space in our spine. So there's no compression when we practice this split type stretch. So we'll hold for one more breath here. And then go ahead and bend your right foot. Just place it down on the floor. Lift your left leg up. See if you can walk your hands up your thigh. And then go ahead and stretch your right leg out long. And see if you can rest your right heel down onto the floor. Think of stretching your right leg away from your body, pulling this left knee in even a little bit closer. Take a big inhale breath. Really let your spine drape over the shape of your roller. Good. We'll take one more breath here. And then go ahead and place your feet down. We're going to lift our hips up, press the roller out from underneath us, and just let our back relax down on the mat. So today we're going to be focusing in on the glutes a little bit. Our glutes are important because they help us when we bend over and squat, but also a lot of nerves that exit our back run right through our glute muscles. So I want to give you guys a little test and pre-test, post-test of why we do foam rolling. So what we're going to try is placing our feet on top of the roller. Let your feet just kind of drape over the shape of the arch of the roller. Press your arms down by your side, and you're gonna lift your hips up and down in a bridge position, okay? This is meant to be an exercise for your butt muscles. So you can check and see if you feel like they're working. See how it feels to lift into this position, and maybe you can't lift super high, that's okay. Just try in and out a couple of times. We'll do about 2 more. Good, and 1 more time here. Excellent, drop your hips down. Okay. So now come on up to a seated position. What we're gonna do is foam roll those muscles, and then we're gonna try bridging again. And I want you guys to see and feel the difference. So to foam roll your glutes, you're gonna go ahead and sit on top of the roller. And I think it's easier to do one side at a time. So I'm gonna do my left side first. What I'll do is walk my left hand back behind me, and then I'm going to tip both of my knees to the side and start to roll. Now you should be on the meaty part of the muscle of your glutes, your butt muscles. You do have some bones in that region, and there's a big bone on the side of your hip. There's a bone sort of where you might sit right on top of your pelvis. The bones do not feel good to roll over. So try and keep your rolling centered around muscle. Part of the reason the bones are uncomfortable is because in between the bone and the muscle is what's called a bursa. A bursa is just a fat sac that's meant to protect friction around the bone. And the bursa gets very irritable with massage. So you want to be gentle around that bony area and try and massage just into the muscle. Now, if you find one spot that's super tight, you can pause there and hold it, or you can continue to just roll back and forth over that zone. Now you can kind of orient yourself more up to the ceiling or really rotate to the side to get more into the side hip. And if you want to put a little bit more pressure, you're going to take your right ankle on top of your left thigh. And for me, that's a little bit too much. I'm going to back off and keep it down to just 1, doing double leg. But certainly give that a try if you'd like. And we'll go ahead and switch over to the other side. So I like to aim for about 2 minutes per side. And you might find that this side is quite different. To note, I just put my right hand down onto the floor, and now I'm leaning my knees over to the right side to get into my right glute. And you can sort of stay oriented more up to the ceiling or really rotate and twist to the side to feel that difference in where you're getting the tension and tightness in your glute. So we'll roll, and remember that some of those glute muscles, they're all the way up by your hip. And so you might want to roll even close to your low back to really feel some of the more proximal glute muscles. Good. As always, you can add in the extra weight by taking your left knee this time and left ankle on top of your right thigh, and just sort of notice, see how that feels. Good. And we'll take just another minute here. Okay. Now we're going to come back to the center, and we're going to try that bridging again. And I want you guys to notice what you feel that's different, maybe what's easier, and just see it, just feel it, so you can get the benefits of what foam rolling really does for you. So go ahead and let your feet drape over that roller again. Your arms are down by your side. Go ahead and try lifting and lowering your hips. And you can even take your hands to your glutes. I always find that after foam rolling, it's much easier for me to get my glute muscles active and engaged, and I'm able to get up a little bit higher with less effort. Try about 3 more there. Good. Last 2. And 1 more time there. Come all the way down. Good. All right, so come on up to a seated position. We're gonna work into our upper back now. So we'll take the roller, flip it around so that the roller is perpendicular to your mat. And we're gonna end up rolling the upper back. The reason we focus in on the upper back is because our upper back tends to be stiffer than our lower back, and it may put actual stress on what our lower back feels. So we'll set up with the roller right between our shoulder blades, knees bent, feet flat, and we're gonna hold our head in our hands. From here, we're gonna actually do another mini bridge and start to roll from the very base of our neck down into our low rib cage. And you're staying on your thoracic spine. Your thoracic spine is your mid back. And you'll know your thoracic spine is ending when your rib cage ends. So you can always kind of poke around and feel, okay, there's the bottom of my ribs. I'm not gonna go past that point. And the reason being is past that point is your lower back, but you also have a number of organs there that probably will not like a lot of foam rolling in that region. Now, as you roll back and forth, you might get some cracking and popping. That's okay, that's normal. Just work within your body's comfortable range. And if you find one spot that's particularly tight, you're gonna put your bottom down, bring your elbows narrow in your peripheral vision, and try and drop your head back over the shape of the roller. As you drop back, notice if your rib cage lifts up and flares towards the ceiling. You want to draw your two ribs down and together, let your spine drape over without letting the ribs pop up to the ceiling. And that's actually going to give you a deeper stretch. And then you can roll and try that same thing again. Remember that because your upper back attaches to your rib cage, breathing here is super important, and you can actually get a deeper stretch by just taking a big breath. Good. Now, a couple dimensions we can add in here are side bending and rotation. So as you're rolling back and forth, you think of tipping one elbow towards its hip. So my right elbow towards my right hip, that's going to help open up my left side as I'm rolling back and forth. And you can do the same thing, checking out your left elbow towards your left hip to open up your right side. And notice which one's tighter. Maybe you spend an extra moment or two being specific to your body and spending a little bit more time on that side. So for me, I always feel like the left side is a little bit tighter. So I'm going to hang out side bent to the right. The other dimension that you can add in here is a bit of rotation. So what that looks like is turning one elbow up to the ceiling and the other elbow down towards the floor. And this is going to help you get into your lat muscle. Your lat is technically a shoulder muscle, but it does attach to your low back. And it also tends to get pretty tight, which I'm sure you guys can feel. You can always drop your hip down and spend a moment just paused in one position. You can also go ahead and rotate to the other side to check out the opposite and sort of see how that feels. As you're foam rolling here, be gentle with your body. It will feel intense and it's probably not comfortable, but it shouldn't be starkly painful. And if it is, you may need to just back off a little bit or readjust your position. Make sure your head is heavy in your hands here. You don't want to stress or strain your neck. And we'll do just another moment with our rolling. Good. And then come on up to a seated position. So you can actually spend a little bit more time doing that. In the interest of this class, I want to get through a bunch of things, but that type of rolling can be really helpful to maintain upper back flexibility throughout the course of your day if you spend a lot of time sitting. What we're going to get into next is a little bit of abdominal strengthening using the roller lengthwise. So this is where if you have a shorter roller, you're going to need to modify just a little bit. So once the roller is lengthwise, I'm going to lie my spine along the length of the roller. And the trickiest part is getting on, but I think the easiest way to do so is to sit on the edge of your roller, walk your hands backwards, and lay all the way down. And if you have a shorter roller, The most important part to get on the roller is your head and upper back. You can then maybe put some pillows under your hips or just kind of hold your hips up in a bridge position. So once you're here, just get settled. And I want you to walk your feet a little bit closer together, like true hip distance apart, as though you're just sort of standing up naturally. And once you're in that position, see if you can reach your hands up to the ceiling. And just notice which side your body is tending to fall towards. Usually we're a bit more dependent on one side of our body than the other. So just notice that. See if you can kind of use your shoulder blades to drape over the roller and almost gently hug the roller and push down into both of your feet equally. See if you can get your balance. Now, if you're able to come to a relatively balanced position here, see if you can close the front of your rib cage to minimize the space underneath the back of your ribs. Bring your hands down to the floor. And we're going to try to lift one leg at a time. Now you have the option here to just stay in that bridge position. And especially if you have a shorter roller, you may want to just stay in your bridge and get comfortable lying on the roller like this. Now, if this feels really tricky and really wobbly, stay here. But if you'd like to progress even more, you can lift both legs up and try alternating lowering one leg and then the other. Now, if you've tried this with me before, try walking your hands a little bit more narrow and just see how that changes things. And when you're first learning this, all of your energy and attention is usually on your legs, but I want you to tune attention in today to what your shoulders are doing and what your shoulder blades specifically are doing. So you can use your shoulder blades to almost grip the roller from the back, and that should actually make you a little bit more stable. So just notice that. Try about 3 more here, and 2 more. And last time, good. Bring both of your feet down. To get out of this position, you can kind of gracefully just fall to the side. You're not super far from the floor, thankfully, and then come on up. It is a lot easier than just kind of sitting up in that position. And that is an exercise I have seen done, but very, very tricky. Maybe we'll keep working on progressing the roll up and down on the roller. So nice job, guys. What we're going to get into next is a little bit of foam rolling work for our calves and our hamstrings. So we're actually going to start with the calves because I find this one a little bit more demanding for our arms. So we'll get that one out of the way. We're going to line up the roller right underneath the meaty part of our calf muscles. And then we're going to use our hands about 6 to 12 inches behind our bottom. If you know you have really sensitive wrists, you can do this on your forearms. So you may want to give that a try. It is a little bit more work for your abs. So not a bad thing, but just to give you that forewarning. Once you're here, we're going to open up our heart, push the floor away, lift our bottom into a low hover, and then you're going to pull your bottom back through your arms and push forward. So it is quite a bit of core work and arm work to be able to do this, but it is very effective to keep our calf muscles nice and loose and mobile. And again, the same nerves that run through our glutes actually come all the way down into our hamstrings and our calves as well. Now, if you want to put more pressure into one leg, you're going to cross one leg on top of the other one, as though you're sitting cross-legged. For me, that is much too intense. I'm going to stick with both legs together, but you're welcome to give that a try. You can also go ahead and add in some rotation here by tipping your body to one side and getting both the inside of one calf and the outside of the other, or rotating to the other side. And again, if you're down on your forearms, you're going to lower down, trying that same thing. No matter what position you're in, although this is a low back class, let's be sensitive to our shoulders as well. If your shoulders are really rounded forward, sit down, take a moment, reset, open up your chest, and then get back into your rolling position. You want to be careful here not to roll right over the knee joint. Again, that's a bony landmark. We don't want to roll over bones. We're sticking just to the muscle here. So we'll spend just another moment in this setup. Excellent. And then we're going to transition into our hamstrings, which actually looks very similar to what we just did. It's just a little bit less exerting. So I'm going to take that roller. We're going to go past the knee joint so we protect the ligaments and joints in our knees, and then get right into the meaty part of our hamstrings rather. And our hamstrings they have the same nerve that runs down the back. So if you have a history of sciatica or any pain that radiates into your leg, make sure you keep your knees bent for this exercise, even just a little bit. So you don't want to stiffen them out in front of you. Once you're there, you can pick your hips up. You can actually keep your feet down for this one for the least amount of pressure, or you can pick your feet up into a little bit of a hover for more pressure. And remember that your hamstring muscle, it comes all the way up to your pelvis. It actually inserts on the back of your pelvis a point called the ischial tuberosity. And so you want to make sure that you get that rolling right up to kind of where your glutes start, and then back down to where the knee is about to begin, but not rolling over the knee. Now, just like with the calves, you can cross one leg and it kind of looks like you're sitting cross-legged. Remember that you're going to keep a soft bend in your knee if you have any sciatica symptoms. And then you can do that cross leg on the other side too, just noticing the side-to-side differences. Now, remember that your hamstring is actually made up of 3 small muscles that run all next to one another. So adding in that rotation here is kind of important to get a sense of what part of your hamstring really is the most tight. So it might be the outside, it might be the center, it might be the inside, but you're just going to rotate your legs to roll a little bit more on the outside on one, and then the inside of the other, and then you can switch. And this is a bigger muscle group, so I do like to spend a little bit more time on these guys. And you know, when you're foam rolling at home, you can really bias your foam rolling to your body, which might be different than mine. It might be different than your friends. It might even differ from day to day when you do certain activities. So you're kind of deciding your timeline of how much to roll based on how your muscles are feeling. But roughly speaking, I would say you want to get about 2 minutes per muscle group, maybe a little bit longer for big muscle groups like your hamstrings and your quads. And we're going to do your quads next, which are the big muscles on the front of the thigh. They are the opposite muscles of our hamstrings. Awesome. All right, guys, so we'll spend just another moment here. And if you want to go back after class and spend a little bit more time, you are more than welcome to do so. We'll take that roller out, and we're going to go ahead and flip to set up to do our quads. So our quads are the big muscle on the front of our thigh, and we're going to use kind of a forearm plank. So we get the added benefit of some core strength when we do this. So again, you don't want the roller to go right on your knees. You're going to lower yourself down onto your forearms and let your thighs rest on top of the roller. And then I'm keeping my feet down for right now, just so I can get set. And in this position, you could let your rib cage sag. I want you to try and lift your ribs up away from the floor so that your core is active and your back is protected. We do all this foam rolling to help our back. So we want to make sure that we are protecting it as we work through the rolling. Now our quad goes all the way to the base of our knee and then comes right up to our pelvis as well. So it's a pretty long muscle. You can keep your toes down and sort of army crawl yourself forward and back. You can also pick your feet up and just push through your elbows to roll front to back. Our quad muscle is actually made up of 4 muscles, and those 4 small muscles go across the broadness of our thigh. So just like the other side, you can roll both the inside and the outside of your quad and just notice how that changes the stretch, changes the intensity, and maybe changes where you're feeling the most tightness. It's a little bit trickier in this position, but you can also cross one leg on top of the other and just see how that feels. Keep pushing your elbows down into the floor. You want to keep your neck as long as possible. And press your elbows back behind you and gently roll the elbows forward, creeping forward on your toes and stretching back through your shoulders. Good. We're going to spend just another moment here. And then last time, gently drop your knees down, push yourself on up, and come on up to a seated position. So I want to show you one other way that you can use your foam roller, which really is it's just kind of an accessory to help your exercise routine. And we're going to do that in standing. So you're going to take your roller up and just balance it the tall way. If you have a shorter roller, just find a position that's near a wall that you can stand by. I'm just going to adjust the camera a little bit here so you guys have a better view. So what we'll do is come on up to a standing position, and let's all bring the roller to our left side. You can rest your left hand down on the roller. What we'll do is practice a balancing exercise called airplanes. And what that looks like first is pushing down with your left hand into the roller. So I want you to think of compressing the roller from the top to the bottom. And once you're pressing down with your left hand, see if you can lift your left knee up and continue to press down into your left hand. Now, if you feel really wobbly here, you're going to stay just like this. If you're comfortable, you're going to dip your chest forward, reach your left leg back behind you, and then come up tall. So I'm going to show you guys from the side. It starts here. I'm going to reach the left leg back, chest forward, and come up tall. The challenge here is to keep the pressure down into your left hand the whole time. And that push down into your left hand, it does a couple things. It keeps you honest about your balance, right? This is not a wall. It does move. And it helps you to recruit some of your core muscles that help you balance in this position. So keep pushing down into the roller. We'll try 2 more on this side. Good. And one more time, push down, 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 come all the way up tall. Take a rest. We're going to switch to the second side. So bring the roller just to your right. I have my roller very slightly in front of my feet. I'm pushing down with my right hand and lifting my right leg. So just get your balance. If you feel off balance and unsteady, you can just do this. If not, go ahead and try and add some of that movement, reaching your right leg back behind you, drawing it up to the ceiling. This movement pattern helps us to build on what is called a hip hinge, which is the ability to bend your hips and not your back. When you're bending over, you're picking things up. And so it's a very important skill to have to protect our back with lifting kinds of things. See if you can continue to push down into the roller as though you're pinning the roller to the floor with your right hand. We have 3 more here. And lift on up tall, good. 2 more, guys, almost there. Excellent. And last time here. And come all the way up tall, bring your feet down and shake it out. Nice work. All right. So I'm going to come in nice and close. That concludes our movement part of the program today. So I hope you guys learned something about how to use your roller and certainly something about your back.